My miscarriage happened in 2009, February of 2009. It was my third pregnancy.
Lost my first baby early in pregnancy. I was really excited about being pregnant, and because I have endometriosis, I didn't know whether I'd be able to have babies. As it turns out, I was very good at getting pregnant because I ended up having, I've had 7 pregnancies and one has survived.
At 9 weeks, we had a scan because I'd been bleeding and baby was there. And then at the 12-week scan, the radiographer said that there was no heartbeat. But because I'd had 2 children, I could see this doesn't look right. How come we can't see a heartbeat?
It was classified as missed miscarriage, so I was supposed to be 8 or 9 weeks. But when I went for the second ultrasound, it turned out that the baby stopped growing at 5th week. And I had at least 3 weeks without any miscarriage symptoms.
There are 3 different types of miscarriage that can happen. There are missed miscarriages, there are incomplete miscarriages, and there are complete miscarriages. So if we think about complete miscarriages first, which is probably what people are most familiar with, a complete miscarriage is if you know you've got a pregnancy and you then sadly experience some bleeding, some cramps, and you may notice that you've passed something like a clot or some tissue, and then the bleeding and the cramps stop. Now that's a miscarriage that is complete. An incomplete miscarriage is when you get bleeding and cramps and some of the tissue of the pregnancy will be passed, but not all of it. So for women who experience an incomplete miscarriage, the bleeding and the pain may not stop and you need to go and see a doctor, and there are certain things that they can do that will help the miscarriage sort of finish.
Unfortunately, with those ones, they have an increased risk of infection as well. And so we're very careful of those women that so they often come into hospital and we manage them in hospital.
And then there's what's called a missed miscarriage, and that's where a woman may not have even known she was pregnant or may have known and thinks that the pregnancy is continuing, and then there's nothing in terms of bleeding or pain at all. And they will only realise that the miscarriage has happened and the pregnancy has what we call failed when they go to a doctor and get either a scan or a blood test that shows that they're no longer pregnant.
I had absolutely no symptoms to tell me that I had miscarried, and we found out at our 13-week scan the baby had passed away at 9 weeks, 3 days.
The stories that I did hear were all the opposites of what I went through. The excruciating pain, the people thinking that they're going into labour, or a lot of blood clots, and I had none of those. So in my head, I was still trying to convince myself, no, this can't be, because it's not the things that you know that I knew about miscarriages at the time.
Then there's what used to be called a blighted ovum, where the placenta and the fluid develops, but the baby doesn't develop inside. Some women find blighted ovum as a negative term because they feel it's very much their baby, even though there wasn't an embryo developed. So we don't use that term as much as we used to.
Our third miscarriage was after our son had been born. With that one, my body didn't deal with that miscarriage naturally, so that had to be medically managed in hospital, and that was probably made it seem more it was harder to deal with, yeah.
When I got told, for me, yes, massive shock, but at the same time, it kind of explained why I wasn't having heaps of symptoms, and for Simon, it was probably more of a shock for you.
It was, because I just walked in there expecting to see the baby. But. And
his face was just shock, so that was hard to see him go through it as well. Yeah.
Molar pregnancy is a pregnancy where you basically have strong pregnancy symptoms, but the pregnancy is not continuing as a normal pregnancy. So basically the tissue of pregnancy continues to divide very rapidly, And so the levels of the hormones of pregnancy, the levels continue to rise very, very quickly, abnormally. And so the woman has extreme symptoms of feeling very unwell.
There's other early pregnancy losses as well. So probably most commonly people know about what's called an ectopic pregnancy, where the pregnancy develops but not in the womb, not in the right place. So sometimes it can be in the fallopian tubes or something like that. And obviously that's not where it's supposed to grow, and so it does need to be often surgically removed.
If a woman has had a miscarriage, the outlook for the next pregnancy is in fact far better than she normally would imagine, even after 2 miscarriages. And reassurance can be provided with an early ultrasound, and if there is a baby's heartbeat, then there's an 80 to 90% chance that pregnancy will continue despite any earlier miscarriages.
We had the first 2 miscarriages before our firstborn, and then we had our first child, and then I was thinking, we're fixed, like we're sweet now. And then to miscarry after having the first one, I felt like we were going backwards in terms of trying to have kids. And the fact that we had found out that we were pregnant and the joy around that, and then finding out that we had lost a child was really, it was really heartbreaking.